Welcome to the Ordinary Doula Podcast with Angie Rozier, hosted by Birth Learning, where we help prepare folks for labor and birth with expertise coming from 20 years of experience in a busy doula practice, helping thousands of people prepare for labor, providing essential knowledge and tools for positive and empowering birth experiences.
Well, welcome to the Ordinary Doula Podcast. My name is Angie Rozier, your host, and we are here today with a very special guest who comes to us from Canada. We have Meaghan Beames with us, and she's from Toronto, Canada, and she is a craniosacral therapist. And we're going to kind of dive in today and talk about what that is and how it can help in the situations surrounding pregnancy, birth, and postpartum for both moms and babies. So, Meaghan, I want to give you a minute, just kind of give us some of your background, tell us a little bit about you, and then we'll kind of dive into our topic today.
Amazing. Yeah. Thank you for having me, first of all. So I am Meaghan Beames. I'm a registered massage therapist. In Canada, we are registered. We're not licensed. I mean, we are licensed, but we call ourselves registered. Exactly. And I'm also a craniosacral therapist. So I have been treating babies since 2018 using craniosacral therapy. And what I noticed in 2020 was that there was a huge jump in need for craniosacral therapists because babies were really struggling. I think, emotions and really hard labors, lonely labors,
So babies can feel that, right? Babies feel.
Absolutely. Yeah. It was wild, and it was stressful. And with stress usually comes, maybe some colic and reflux symptoms. And so there was a huge need in my city for more craniosacral therapists because those are things that we help with.
Yeah.
And there weren't enough of us. So I decided that I was just going to build a curriculum for folks in my area who I could train, and I could get more people on my team. And then from that, I designed a whole curriculum for health professionals. So now I teach people all over the world, especially health professionals, how to do infant craniosacral therapy. And we've got people in almost every continent.
Wow.
Now.
Very cool. Yeah. Good for you. That is excellent. Very, very cool. So tell us a little bit about and maybe folks know, maybe they don't, maybe it's a new concept. Tell us what craniosacral therapy is. What's your elevator speech on what that is?
Absolutely. So I realize that it's a long word and it might be a little overwhelming or intimidating, the word, but it's actually what we do is incredibly gentle touch to feel through the body, to find areas that are tight. And then with that same very gentle touch, we release those tight areas. And when those areas are released, usually it helps to restore function. So what we're looking for as craniosacral therapists is areas of tension. It could be areas of stored emotion, experiences, trauma, that type of thing, that can live inside our bodies. And these areas that are stored, sometimes they don't serve us well. And that's what's throwing off the functioning of our body. So we use really subtle ways of finding those areas and really gentle touch to release them. So the reason why it's called craniosacral therapy is because there's a fluid that runs from the brain to the sacrum in this wave-like motion that goes, up and down. And so that cerebral spinal fluid, which is the fluid that goes through, that's where the name craniosacral therapy comes from.
Okay.
So it does sound overwhelming. However, it's actually quite simple.
Okay. So tell me, and I've had a few sessions myself, and I think it's amazing.
Oh, beautiful.
And the touch points. So we hear cranium and sacrum, right? So tell us the touch points, but I've also had my feet worked on in some of my sessions. Tell me what kind of touch do people expect? It's very gentle. Or tell us where the touch might be happening.
Sure. So yes, we do have holds on the cranium and the sacrum so that we can kind of test to see how is that fluid moving from the cranium to the sacrum? Is it, is it getting stuck halfway through the spinal column? Or is it kind of just hanging out much higher up in the head? And sometimes if it is either stuck, that can cause migraines.
Hmm.
So yeah, recurrent migraines. So what we
Okay.
do is we try to encourage that fluid movement from cranium to sacrum through these different holds. Um, However, it could be your feet that are tight that is causing that fluid to not move very well. So we
Interesting.
place our hands all over the body because, and studies have shown that cerebral spinal fluid, the fluid that actually surrounds your brain, actually extends all the way out to your peripheral nerves. So
Wow.
even all the way out into your fingertips. Yes.
Interesting.
So when we are touching your feet, we have a direct link to your cranium.
Wow. Hmm. Very cool.
And when it comes to babies, what we're looking for is, so not everyone knows what fascia is. Are you familiar with fascia?
I
Yes.
am.
So,
Tell us though. Tell
so
us
we
about
work,
fascia.
absolutely, we work so much with fascia, because fascia is this protective tissue. So I'm going to describe, and I hope it doesn't bother some people, I'll describe it in the vegan way, and then maybe if you don't want to listen to the non-vegan way, you can listen. So imagine that it's an orange and you peel off the skin of an orange, and then you've got the flesh underneath, right? The
Mhm.
juicy, fleshy orange underneath. That stuff that you peel off is essentially fascia.
Hmm.
So it's protective and it keeps everything in its place. Now, if you're not a vegan and you're ready to listen, it's like chicken, right? So let's say you're cutting a chicken breast and there's that white filmy stuff that you're like, oh, this
Yeah,
is
you can pull
really hard
off.
to
It's
cut.
tough. Yep.
Exactly. Very tough. You can pull it off. It separates from the meat very easily. That is fascia. So that, because it's, you can tell how tough it is to cut through, that's how tough it is in the human body as well.
Okay.
So, but it's protective tissue, like I said, and so it contracts like a muscle does, but it doesn't release like a muscle does, right? It contracts and it stays in that contracted state until or unless we use either gentle touch, or some people find that fascial release is really beneficial. But one of the best ways to help that area to release is by encouraging rather than forcing, right?
Mm.
Because it's
Mhm.
protective.
Yep.
So it's also highly innervated, meaning there's so much nerves. And again, our emotions also are controlled within our nerves. And if you're telling this fascia, well, you got hurt and you need to change, it's going to be like, but why? I am
Yeah.
protecting the
I'm
thing
doing
that's
my
underneath me.
job. Yeah.
I'm doing my job. And it's like, okay, so instead of saying you must change, you can say, hey, you did a great job, but it's time to let go and move on from what you did.
Okay.
Thank
So
you
it's
for
like
doing your job.
being a caregiver of the fascia, letting it release.
Correct.
Okay. Okay.
Exactly.
Very cool.
And so that fascia lives just the same in an infant body as it does in an adult body. And just because we have, as an adult, we're able to perhaps retrieve memory because we have that type of brain, infants will also have stored memory. They can't actually go in and retrieve, but it's still stored in their bodies.
Hmm. Okay.
Yeah. So
So
it's
tell
it's
me,
very
like
tender.
with adults, there's a lot of compounding life experiences, right, for an adult.
Yes.
So I'm just imagining maybe that tension can build up over time.
Correct.
Okay.
Yes, absolutely. So what I like to say is exactly what you said. Compounding is like compounding interest, but it's really compounding torsion, compounding tension. And whenever you say, "Oh, I've got this injury from when I was 15 and it just never went away," that's the compounding,
Hmm.
right? That's the
Stays in the
fascia.
body.
it stays in the body,
Got
right?
you.
Or let's say somebody had a concussion. So fascia surrounds the brain. Let's say somebody had their concussion and so you know, a family member says, well, after they had that concussion, they were never the same. It's like, yes, because not only did it, perhaps damage brain, it also contracted that
Mm,
fascia around the brain, and that fascia stays in that
stays
contracted
tight.
state,
Mm,
stays tight. Exactly.
okay.
So once we release that, then lots of things can change. And so I actually work with a lot of teens in sports
Mm,
who
mhm.
get concussions, who get recurrent injuries, um, and they're able to go back to school. So sometimes they're even out of school because they got a concussion and they were never the same.
Right, right. Interesting. Okay. So this can address physical things,
Yes.
sounds like emotional things. And in a way, and this is something I love about craniosacral, it can address it pretty deeply, but pretty gently, if that makes sense. Like very effectively, but in a very gentle approach where we're not drawing out all
Absolutely.
this trauma, maybe reliving like some other therapeutic modalities. This is addressing it in a very subtle, gentle, effective way.
Exactly. So when an experienced craniosacral therapist is providing this session, only then will they maybe bring up some of the things that they're noticing that could be emotional, right? Um, and they'll only do it once they've built a rapport with you because we don't want you to re-experience your trauma.
Mhm,
And the body can actually let go of this trauma without being aware of it happening.
Interesting.
Yes.
That's pretty
So some
powerful.
people really want to have that intellectualization, meaning they want to be aware and they want to think about it and analyze this change and this release. Whereas some people don't want to ever re-experience it.
Just let it go.
However, exactly. Both instances, the body is able to let it go.
Hmm, fascinating. That's cool. Could be a
Yeah.
powerful tool. So, with that, this powerful tool, let's bring this to pregnancy and
hmm
how can tell us with I assume tell us about working with a pregnant client. Tell us a little bit about the potential of craniosacral and how you incorporate that through a pregnancy before, during, after delivery. Tell us, the role of craniosacral there.
Absolutely. I would love to because cranio is a wonderful modality, not only for relaxation, but it's also wonderful for birth prep.
Mm,
And so, like I said earlier, you might have an injury from when you were a teenager, and that can create torsion patterns or strain patterns in your fascia that can almost shift your pelvis into not an optimal alignment for your baby to sit in a good position. And also if somebody had any really hard injuries on their bottom, they fell on their bottom, let's say on ice, or they were a snowboarder, or they were a figure skater, or they were a gymnast, or they were anything that you can get this jarring on your sacrum. Maybe you broke your tailbone, you jumped off a thing, you jumped out of a tree, you broke your tailbone, like anything like that. Those things stay in the body and they can limit the amount of movement within the pelvic bones
okay.
or
Which we
pubic
we maximally need that movement, obviously, during labor.
bones. Correct. Exactly, we do.
Okay.
And it can also limit the amount that you can feel or you can sense in that area.
Hmm.
It can also create, without this lots of movement for, let's say second and third trimester, you can get excessive round ligament pain on one side or
Hmm.
the other. Yeah. Or pubic symphysis pain, right? So perhaps we're not getting this baby into a really great position and it's just putting so much strain on these bones.
Okay.
So it can really help with um, optimizing position of baby, not just for baby and birth, but for gestation, just like
Right.
just
In
to
pregnancy and
enjoy your
growing.
pregnancy.
Yeah. So
Yeah.
a lot of some of the things you just addressed are what we consider, the industry considers common discomforts of pregnancy. And
Sure.
that is like, I know so many clients, I had it again yesterday, clients will say, hey, I asked my doctor about this, and they said, yeah, that's normal to pregnancy.
For
So,
sure.
and what I've heard from a lot of different other practitioners in lots of different realms is we don't have to have those regular discomforts and just live with it and put up with it, right? So you talked about round ligament pain, symphysis pubic pain. These aren't something we just have to put up with, right? Sciatic pain, I imagine, similarly, the common things
Exactly.
that
Yep.
pregnant people complain about. So
Hmm.
tell us, like, in the course of a pregnancy, I know there's like ideal, there's a perfect world, there's something, we wish everyone could have this. In the perfect world, for craniosacral, what would you wish every pregnant person could have craniosacral wise through their 40-week pregnancy?
I would say preconception. I would
Okay.
say yes. Um, in the craniosacral world as well, we talk about having um, a, a loving womb to
Hmm.
enter.
Hmm.
Yeah.
Okay. Yeah.
So preconception would be clearing out past traumas from the womb space. Would be ideal so that when this baby comes in and implants, they're implanting in love. Um,
So
and
this gives me a new question. Is this something that
yeah,
also could have the potential to address some fertility challenges?
potentially yes.
Okay.
Yes. Not guaranteed. Nothing is
Right. Right.
guaranteed, but potentially yes. If
Interesting.
this person is experiencing um, unknown um, pregnancy loss, like miscarriages, right? They've checked the sperm, they've checked themselves, and it's just like, why isn't it working?
Hmm.
Maybe
This could be
there
something
is
to
an emotional,
explore. Okay.
correct.
Okay.
There could be some emotional aspects there. And this is not a blame or shame game. This is
Right.
a,
That's how it
have you
is.
experienced trauma?
Yeah.
Do you want to let this go? It's not a, it's also not an infomercial, um, but truly, um, it would be optimal if it was in a healed space. Yeah.
Yeah. Yeah.
Uh, I mean, healed also equals, can include scars, and that's okay, right?
Yeah. Yeah. For
So
sure.
we don't want to clear it. We understand that it's part of life. So that would be number one, would be preconception, and then at least one for every trimester, one session, one full 60-minute session per trimester, and then as you get closer to the end of gestation or closer to birth, increasing to biweekly craniosacral. What I really love to do for the ones who are in third trimester, I like to feel positioning of baby, see where they're sitting. I also like to encourage the parent to like breathe
Yeah.
and
That's
understand what
important.
it feels like while they're breathing and this baby is moving. So I'll get the baby to move and then I'll breathe so that they can kind of tune into that area and what it feels like for the baby in that area as they're breathing, because breathing during labor is, as you know,
It's a huge
incredibly,
tool. Yes.
it is a huge
We're
tool.
going to be
Also
doing
the
it.
baby, you will be going to do it. And the other thing is that baby also benefits from all of that oxygen and release of carbon dioxide as well. So
Yeah.
it's really, really important for baby as well to have good breathing during
Okay.
labor. So yeah, increasing as they get going. And then pièce de
The most.
résistance is during labor. Let's say this person is, they've got, baby's in a great position. They're laboring, doing great. However, contractions are really stalling. And you're
Mm.
like, how can we increase oxytocin? Without using Pitocin, how can we increase oxytocin? Well, the pituitary gland that sits in your brain is where we release oxytocin, right? And so, what if this person who experiences multiple migraines a year, that maybe their pituitary is a little bit stuck and can't release as
Hmm.
much oxytocin, right? So it's like,
For the
I don't know
labor,
why your
the
body
current
doesn't
labor. Yeah.
exactly. So
Cool.
going in and doing a little bit of like this rocking back and forth, you just rock the sphenoid, the bone that the pituitary gland
Mm-hmm.
sits in. You can rock it back and forth. You can wiggle it a little, and a release of
Do a
oxytocin.
release. Interesting. Very cool.
Yeah,
So have you helped people in labor?
I haven't, but I've heard it. But didn't I
So
tell you I
cool.
want to be at every birth?
I
So that is my
you said
goal.
that before we got on. She's kind of a birth junkie behind the scenes.
I am a birth
Which is
junkie.
awesome. Very cool. Okay. So this could be a good piece of preparation for labor and birth and a
Absolutely.
healthy, comfortable pregnancy.
Correct.
Awesome. Awesome. Awesome.
Exactly.
Okay, how about postpartum for a person who's just given birth? Tell us about the benefits of postpartum.
Okay. So as we all know, postpartum. So let's talk about C-section. So let's say this person goes into labor, they're in labor for 30 hours and then they get a C-section, emergency C-section. That person has just experienced, for lack of a better word, being hit by a truck and then and then having abdominal surgery, right?
Yeah.
So like severe abdominal surgery. And so the healing from that experience takes much longer than somebody who has a
Mhm.
scheduled C-section.
Yeah.
And that's, all of these because of lots of muscle tension and contractions, as well as contraction of fascia, right? So
Right.
their sacrum might get really, really tight. Their hips might get really, really tight. Um, their whole body is aching. Maybe they had the shakes, right? So there's maybe they had Pitocin and epidural or a spinal block, especially for a C-section. Now we've got an increase of medications in our body, and so the body has to detox those medications. And what craniosacral can do is we can help the body to release the tension, and then we can actually pump the system that clears out the medication toxins.
Hmm.
So they can, so the epidural,
Mhm.
we work with the dura
Yeah.
of the body, right? And so the epidural is the administered on the outside of the dura. And so that if we get a cerebrospinal fluid leak, then that could be really bad.
Right. That's
And
terrible.
yeah, right. So what we want to do is help this body to flush those toxins. Um, Also to help with milk production, letting
Okay.
that milk come in. Because the more medications you take in labor, likely the longer it takes for your milk to come in.
Hmm.
Um, and and then your baby might experience jaundice or low milk supply or needing to go for phototherapy or
Right. All the
formula,
things that
right?
come
All of
with
those
that.
things.
Yes. Ugh.
Those things. Now, the only thing with the C-section though is that you don't want to do it right away.
Mhm.
You do you do want your body to heal a little bit before receiving this.
And I
Depend
imagine
it
too, like in a C-section, there's been some fascia that's been absolutely breached, right?
Absolutely.
Yeah. So we're not just like
Absolutely.
tense, we're like breached fascia that's repairing.
Correct. But that is repairing. Absolutely. Yes. And it is tense fascia that has been breached that is now trying to repair itself. So
Yeah.
it's like a whole all
Uh,
kinds of messed
Lots
up.
going on. Yeah.
Lots going on. And so people who experience those types of labors and birth also then go on to have either migraines or backaches or leg pain or leg shakes or restless leg syndrome
So these are things that could
or
be years down the road, months and years
correct.
later. Hmm.
Absolutely. Exactly. And so, after that experience, it's good to let those things go,
Hmm.
right? Let that
Hmm.
fascia relax, release, um, and allow those bones to settle in a more optimal way.
Okay. So let me ask, I know this is specific to cesarean delivery.
Mhm,
How about just
mhm.
a really rough, like, we talk about traumatic birth and that can be different things to different people, but just a
Yep.
very physical, very long, very exhausting, or very emotionally, and birth is all of those things, right? It taps into
Yep.
everything we have. Tell me on what some might consider a traumatic birth,
Mhm.
emotionally, physically. How can craniosacral help in a case like that? And do they need to wait for that after recovery of a cesarean? Tell me on a tough vaginal delivery, maybe what the role for craniosacral could be there. And that might be emotional
For sure.
trauma that happens as well.
Yeah, I mean, the emotional trauma is absolutely there for cesarean, especially if it was
Yep.
an emergency and
Yeah.
clearly unwanted, So there's that emotional pain that we can help the body to release. Maybe not the mind so much as the body, right? The
Hmm.
mind might come. Um, and but for vaginal delivery, let's say it's a long pushing stage. Long to me is anything over 30 minutes. And so 30 minutes to 6 hours, I've heard people go to 6 hours and they still deliver vaginally.
Yeah. We had a
What?
9 hour this year, which broke our
Oh,
record of 7 hours.
wow.
Still
Okay, that's
delivered
the
vaginally.
longest.
Yeah. It's pretty wild.
Fascinating. I know that they take breaks, right? That it's
Yeah,
like,
yeah. It's not
2 hours
solid
off.
pushing. Yeah.
Yes, exactly. They take a nap and those types of things. However, their body is still contracting even when they're sleeping if they have an epidural,
Right.
right? So the uterus is still contracting. There's still this tension living in their body. And sometimes I got my baby here. Um, because I
Awesome. We have a
always have my
baby head.
baby.
We have a little baby head here.
Because I also teach from home, I usually have my pelvis here so
Oh
I can
yeah.
demonstrate what it's like to have the baby come through the pelvis. But so let's say we've got the baby on the, like hanging out and they're just pushing on that pubic bone, right? Now it's going to spread this pubic bone and that's going to put pressure on their back
Right.
and they're going to have this back labor. And then the fascia is going to contract in that area. So it can actually like spread the bones in a way that they don't come back well,
Hmm.
right? And so let's say they do that for a couple of hours. Um, so that tension around the pubic bones or the sacrum can live in the body after. And then people are like, I had my baby and I just don't feel the same, right? Now, because they haven't had surgery, unless they had, second degree tear and above, right? Let's say fourth degree tear, you're going to want to heal a little bit because
Hmm.
moving is tough.
Right.
Although, if your craniosacral therapist does home visits and you are laying in your bed, then
Hmm.
absolutely you could get your own session within a day or two of giving birth.
Okay.
They obviously would um, um, avoid the perineum,
Yeah.
I would hope.
Right.
The craniosacral therapist does not need to do unless they are a pelvic floor therapist, but even then,
Yeah.
they would
That's not
probably
time
they
yet.
would exactly they would avoid that area. Um, However, you don't have to touch that area to feel relief.
Okay.
You
Yep.
could touch, right? Because fascia connects in every part of the body. Every part of the body through fascia is connected actually at the base of the skull.
Mm.
So we can help release many parts of your body without even touching them
Yeah.
by touching, let's say, the knees, the ankles, the outer hips, your glutes, your shoulders, right? Your neck and your head can all have an effect on releasing tension in the womb space, in the pelvic floor, in those bones.
Okay, very cool. That's
Yeah.
a great tool. So tell me, what can people expect maybe when they come to a session? I know kind of what I've experienced, but tell me what kind of space are we going into? What's the posture we're taking? What can you expect as far as your immediate surroundings and what the your touch experience will be like?
Sure. So for the majority of craniosacral therapists out there, I can't speak for all of them because everyone
Yes.
practices differently. But for the majority of them, they will have you laying on a table. You will be fully clothed. This is not a clothes off party. This is a clothes on party. You lay um, on your back facing up. Um, a lot of times you'll have pillows to support your knees. If you've had a C-section, then you might be in a semi-reclined position. Or if you are pregnant even, you would be in a semi-reclined position. so that you're not completely laying flat on your back, because that can cut off some blood flow
Yeah.
and types. Yeah. So semi-reclined position, propped up, lots of pillows, very comfortable. Uh, Craniosacral generally brings in people, very holistic type people,
Right.
people who are healers, people who want to help in the most possible way, and people who have also experienced traumas of their own, right? So they are usually trauma informed, or they are usually in the world of, I just want to help people.
Mm-hmm.
So usually,
Yes.
again, I can't speak for all, but for the most part,
There's a
yes, that's what you'll
pattern.
find.
Yeah.
Exactly. So some people might have, um, they might have stones, or they might have gems, or they might have crystals, or they might have all of these things, and they might have, and that doesn't have to be your thing. It
Mm-hmm.
is literally for them, right?
Yeah.
Practitioner. That is
Okay.
to help them clear their own space, so that those crystals are not there for you.
Okay.
So if you're like, oh, I'm walking into these crystals because she thinks I need these crystals, it's not for you. Um, it is for her. She's protecting herself. So, and so, so that might be something that you walk into, or it might be a very clinical space. And both are fine if the practitioner's intention is to help. Yeah.
Okay.
So the touch is very gentle. They will have their hands usually very lightly in multiple different places on your body. So they might stay at your feet and listen. So we call it listening. They'll listen to your body at your feet, listen to, or assess, how do the feet move? Are they moving symmetrically? Because with the craniosacral rhythm, the feet will turn out, and then the feet will turn in, and then it'll go in this pattern. And if it's not symmetrical, right? So we've got one going
Yeah.
like a little bit
Something to
differently.
explore there.
Exactly. It's like, oh, well, right side's moving really well, but left is all clunky. So what's happening with your left body?
Hmm.
So that's going to tell them where they can work in your body. So, what I teach people is, so you're listening to where the body is telling you to go. And so if they are at the feet and they are told to go to the left hip, they'll just bring their hands, they'll come and sit beside you, slide one hand underneath you and one hand on top of your hip, and they'll work there. And they could be in the same position for like 5 to 10 minutes,
Okay.
depending on what's going on. What I teach my people is, you should be bored. Like, you should be working in this spot for so long that you're like, how long have I been here for? Right. Because that fascia, especially on an adult, like you said, compound, we're going to call it
Maybe some
interest because
work
that's
to
the way it
do.
works. They got some work to do in that space, right? Like, who knows? And so for the person on the table, they might be like, well, this is wacky. There's nothing happening. They're just sitting here at my hip. However, if this person is paying attention to other things, like their right foot keeps twitching, that is a sign that what your practitioner is doing is working.
Hmm.
Or let's say now they get this like shooting pain up their back. That is a sign that what the practitioner is doing is working.
Right.
Or if they start getting these like visions or memories, oh, remember the time I was running away from the bus and I tripped and I fell? Well, guess what? Guess what's stored in your left hip? That time you're running away from the bus, or you're running away from a kid and they tripped you.
Hmm.
It could be that, right?
Interesting.
So yeah. So when we go to a massage, we expect pain for it to be working. When we go to a craniosacral therapist, we expect relaxation and almost boredom
Mm-hmm.
and memories, and perhaps even emotion that comes up that you're like, I have no idea what this is about,
Mm-hmm.
but
It's releasing.
it's releasing. Something's coming out. I'm crying and I don't even know why.
Yeah.
So
Interesting.
two different things, very, very different things to expect.
Okay. And I think the sessions that I've been on, and I absolutely love, because I refer a lot of clients and I'm like, I gotta check this out. What are they experiencing?
Yeah.
And there is a fascinating, I don't even know how to put words to it, but almost on either side of my body, maybe along meridians, I could feel an awareness, not a
Yes.
pain, just a sensation going all the way down, like in my organs, in places I can't typically locate, like, okay, where is your
Yes.
spleen? Like I can say, okay, here's my pinky finger, but I felt on both sides of my body going down. And I've also had crazy deep sleep. Like I could have thought a week
Yes.
went by and just this incredible deep sleep. And my craniosacral therapist has told me a couple of times, a couple of the sessions, which I think is fascinating. That's why I always ask her, I'm like, what are you sensing? But she, from my own birth, which was, many, many years ago in the 70s, she could tell based on my body where I lay in utero and the
Yes.
position that I rolled out
Correct.
through the pelvis when I was born, which I thought was fascinating. And it made a lot of sense. She's like, you probably always like to lie when you're sleeping, lie on a certain side. I'm like, yep, yep, yep. She goes, that's how you lay in utero. And so she told me about my birth, which I didn't even know that was a possibility to learn from my body about my birth, which was pretty cool.
Yeah. Yeah. There are some practitioners who will do a rebirthing experience and they'll actually encourage your body to make the same movements that you did trying to come out, working your way out of the birth canal.
Very cool.
And we can do that with infants, we can do that with children. And it is very reorganizing for the brain
Hmm.
and releasing of stored traumas. Like being born is the first traumatic experience that every single human experiences.
Right.
There
Can't
are
get
other
away from
traumas
that.
that you cannot. So the one thing that people are like, oh, well, like, why would I need to get a craniosacral therapist? What makes me need like a CST session? And I say, you were born.
Yeah, right there. You qualify.
You got born. It's stuck in your body. We got to work it out. Um, and they're even finding that with somato emotional release and somato experiencing is that this is this new wave of like mental health and which I'm totally here for, is that the majority of the things that people are coming to their first session with is their own birth, like their
Interesting.
own being born
Hmm.
story stuck in their body.
Wow.
Yeah. Yeah. So yeah, yeah,
Very
exactly.
cool.
We can find those things, um, explore them and release them, or allow your body to find its new normal,
Interesting.
right?
So that's such an
That's
impactful experience, obviously. However you were born, it's going to be a huge experience for the body and
absolutely.
therefore the soul as well. Interesting. So
Yeah.
this has been fascinating. I want to take a quick little turn and ask you a question. I didn't prep you for this, so I hope this is okay. So tell me, there's other modalities. You are a massage therapist.
Mhm.
There are chiropractors. And for my clients in certain situations, well, I love, in an ideal world, everybody would have everything, right? But where chiropractic care is key to say a VBAC or turning a breech baby. There's and comfort, right? Relieving some of those common discomforts of pregnancy. Same thing with massage therapy. So how does craniosacral therapy, how do we fit all those things together? How do they interplay off of each other? And is that situationally based or can everybody use everything? Tell us a little bit about how all those modalities may work together. And maybe others I'm not even mentioning beyond licensed
Absolutely.
massage therapy, craniosacral, chiropractic. For those who seek that kind of care, how do they play together?
Yeah. So craniosacral was designed to be a conjunctive modality, meaning it is designed to be used with another modality. It's great on its own. However, if you've got something going on, especially chronic, especially long term, um, it is to be used in conjunction with. So it could be used in conjunction with diet, or seeing a dietitian. It could be used in conjunction with a chiropractor, because chiropractors, for the most part, not all of them, but for the most part, focus on joint and joint mobility, whereas we focus on fascia. So we
Hmm.
release the fascia, your chiro that goes in and releases the
Ah,
joint. Yes, and
you may need
you
both,
get
right? Some
you might
situations
need,
you need both.
absolutely, and some chiros do both.
Hmm.
However, the ones who don't, who are not going in and manipulating soft tissue, you're going to have less long-term relief. So you might need both of those things, right? And now the other thing is that it's good with is PT, right? So you might need to
Hmm.
release an area. However, then you need to go in and strengthen. It doesn't mean that you don't need more strength in different areas. It just means that, the tight area is relaxed or released, and then you can actually strengthen
Then
it in a more
strengthen it.
optimal way.
Okay. Very
Yes,
cool.
exactly. And also occupational therapy, speech language pathology, right? Especially for kids, you've got to do those exercises after. You
Right.
have to do that coordination. You have to learn how to breathe properly. So again, this modality is used to, optimize function because we're releasing fascial restrictions and adhesions, and so the other modalities come in and do the other work. So it was designed to be the foundation, and then you build upon it.
Okay. So you work like plays well with others. So like we want to be using other modalities. So that you bring me another question. In my mind, it sounds like, and maybe I'm projecting, this could work really well with some emotional work if we're working on, like, say with a therapist, if we're working with a coach, like something like that. This could be a good pairing with emotional work as well, mental health therapies as well.
Absolutely.
Okay.
Absolutely. And in fact, I am not a huge lover of the word should, but it should be used in conjunction with like talk therapy.
Okay.
Because if you are forgetting the body, then the body keeps it, then you're just going to ruminate.
Right.
Okay. So this mind-body connection that we're all becoming very aware of is very real, and releasing the body and releasing the stored trauma, the stored emotion, the stored experiences in our body will then have a huge impact on our mind.
Okay. Excellent.
And our mental health. Yeah.
Okay. So this is a good pairing for a lot of positive efforts for a healthier, physically, emotionally, like in every way, healthier life.
Yes. Spiritually too, right? Because it brings us closer to what to what brought us here. Truly.
Cool.
It brings us closer. Yeah.
Awesome. Cool. Well, Meaghan, this has been very eye-opening, and thanks for laying it out. I can see, like, I know this is pregnancy related, but gosh, it extends beyond that. So we could have all kinds of reasons to use this in our lives for health, for well-being, for happiness, joy, and release of tension. I love that.
Thank you for listening to the Ordinary Doula podcast with Angie Rozier, hosted by Birth Learning. Episode credits will be in the show notes. Tune in next time as we continue to explore the many aspects of giving birth.